Hello guys. Have you ever wondered why people struggle so much to go to JICA, Europe, Japan, to be helped in health-wise? You don't really have to do that. Welcome to Korwenje. Next to the gate, we have our staff house where our staff lives. Just behind it, we have our garden where we plant our vegetables, maize, and other grains. But right now, as you can see, it's so dry. It's dry season, no rain, no food. Next to it, we have our fire assembly point, which also acts as our roundabout. Just far behind it, Korwenje owns no car, but we are ambitious. One day, one time, we'll have our own car. We have a car park. Next to it, we have our resting area where our patients rest after or before being treated. Then just across, we have our water tank where we store our clean rainy water. Next to it is our sanitary area where we have our toilets for ladies and for gents. And just below, next to it, we have our compost pit.
Restoration corner. Patients are waiting for their turn. And this is drinking water. This is ORS. And there is an information board. It's very organized. And then they put food demonstration too. Consultation corner. And then the next is procedure corner. And then there is a dispensing corner. This is a counseling room, VCT. PSC room.
Go this one. Here we do quite a number of services in improving healthcare through clinical excellence in the field of compassion, whereby we tackle each and every patient every time. We have quite a number of activities ongoing. Amongst one of them is antenatal care. We also do patient support services. We also do immunization services, nutrition services, postnatal care, home-based care, treatment of child illnesses, treatment of adult illnesses, among others. Apart from that, we also have community strategy in force, a scenario whereby we want to do away with the curative services or try to reduce curative care services, and therefore invest much on preventive services. And therefore, community strategy, we work very closely with our chief, that's a public health officer, to see that we reach out the people so that preventive ideas are inculcated in our clients. Our chief is very hardworking and is doing that work very well, so that the community referrals is not much of a problem. Things like preventive measures at home are being taken care of very well with our community health workers from those CEOs.
Community facility linkage is okay because I have a facility in charge, that is Mr. Job Okello, who is so open and so determined to work with the community and the facility at the same time. We do home visits, we do outreaches, we do dialogue days, we do facility meetings, so many things that as a chief make my work so easy. So without the cooperation from facility, my work as a chief in the community cannot be felt, because we coordinate the two, we become one, then we make a better living for the people of North Central Seme.
Kata ni jadi maringe 500 this time. Ni ana iya ni kadi already 500. Kata ni jadi maringe 1,000.
So they say if you have a bigger number.
Yeah, next brill. Erma brill. To mai mar moroja. Moroja ne igni adi. Anyway, boy. And you don't know what you don't. You look again. That is 11.
Intiere ke glass. Sawa. Lakini thiedho yath kende, thiedho pi kende. Ok ong'iso ni koro pi ler inyalo modho. Sawa sawa.
Loso kodgi te. Ok inyal loso kodgi.
Ni en oluoke dha aora, ok ool pi koni, en oolo pi koni. Mana we neno 19 chon. Andore interview, ma baby bang'e kusetieko session gi madam. Wanyalo luongo somewhere under tree, then we talk about korwenje yang.
An gima neno, korwenje yang madhas. Gipuonjo ji kaka onego bed ni wabet e mier kata e dala ka kuma intiere. Koro omiyo aneno ni mondo kata asedhi tedo kamano to mondo pod abeda gi korwenje yang madhas. Nano ok anyal weye sana. Pod abo madhi kode mbele. Mana gik mananeno, manadar. Shida mananeno, yani kane an gi nyathi, koro kane nyathi pure, tini sama nane adhi ruon nyathi awa mondo timana othiedh na nyathi. Koro emomiyo naneno ni mondo adonje korwenje yang madhas mondo puonja kaka nya timrana, kaka nya bet gi nyathi. Tema bang'e to nyathino to koro naneno ni mondo kar bet kanyo, nikech weche mang'eny be koro ne wuoke, koro aneno ni mondo atim manade mondo adhi atim. Koro santa an gi wuon nyathi neno koro sani adak, koro pod an dak.
We are teaching people, like those who are younger age. You know, some give birth at a younger age, like 14 years old. We are encouraging them. We are telling them that is not the end of their life, so that they just continue with the life. They pursue what they want in their life, like education. Like some tell us that they want to go back to school.
Yeah.
It has helped me to interact with other people. We are getting teachings from others.
Okay.
As a young mother, we have something called demand, the high demand. People want many things, like for example, like nowadays early marriage. People want us, in that you have given birth now as a teenage mother, you are being forced to go and get married at that your age. I'm not. My father wants me to go for further education.
I'll tell you something little about this young mother support group, which was initiated here a year ago. This we did after a very thorough scrutiny and forensic data taking on NC profiles. We came across a number of these young school-leaving children, age group between 14 to 21, who are getting pregnancies before marriage. We realized that it's very critical for us to start such kind of a group so that we mobilize them together, so that we can be in a position to encourage them, see how we can tackle reproductive health issues among this target population. Currently, we are engaging them on capacity building on reproductive health issues. We are also trying to do community dialogue with their parents so that it is not something isolated. So that as we engage them at the group level, we also see that we do community dialogue so that their parents can also get to know how to go about their operations where they stay.
And we've been having some visits from the CHIU. He has been monitoring the health conditions in the school. He visits us, goes to check on the latrine conditions. He even advised us to be using ash as a way of disinfecting the toilets, and that one is really helping. It has reduced the smell that was coming from the toilets. When he comes to school, he checks on the condition of health, even the pupils, then he advises us on what to do. He also checks on the lunch program, if it is done in good environment. And from the CHIU, we are encouraged to live in a clean environment.
One of my responsibilities is to oversee the activities of the health facilities. One of the health facilities is Korwenje Dispensary. Since we started working with that facility, we've seen quite some improvement. Since Job came in the year 2013, we have seen his leadership skills has really helped the facility to improve on its services. Some of the areas that show a lot of improvement is their teamwork among the staff working there. There is also improvement in the facility linkage to the community. There is also improved cleanliness, and also client flow has really improved in the facility. Also, we require that the health facilities report every month to the sub-county level. Also, their timeliness has improved greatly. So, to mention just that the community linkage has really enabled them to be able to access the households, and they have managed to get the malnourished children and even adults. Support supervision also has given us great results, because the team at Korwenje has been able to implement the action points after support supervision, and this has really helped them to be what they are today. It's one of the smallest facilities, but they are able to do great work. So we are really proud of the team working there.
Umoja ni fahari yetu, undugu ndio nguvu. Chuki na ukabila hatutaki hata kamwe. Lazima tuungane, tuijenge nchi yetu, pasiwe hata moja anayetenganisha. Naishi na tumaini, najitolea daima Kenya, hakika